This is episode number 111 of the Life, Strength, and Health podcast. I'm Kim, and I'm joined with Jamal.
Greetings, everyone.
And
blessing.
Yes, and thank you for joining us this week. This is part 2 of our interview with Lisa Hendrickson-Jack, and the title of the episode is The Fifth Vital Sign. And we're talking about what that is and diving into her new book that she released, which the title was The Fifth Vital Sign, Master Your Cycles and Optimize Your Fertility. You know, it was a great interview, so much information. And as we did with our first time that Lisa was on the podcast, we decided to break up the episode into 2 pieces so you can fully digest the information that was shared. So this is part 2 of that interview. And if you haven't had a chance to listen to part 1, just go to lifestrengthandhealth.com/110 and make sure you listen to that episode. This week's testimonial is from JC. And JC says, I needed a complete reset. My stress and hormones were making me feel completely run down. Life, Strength, and Health helped me redefine my stress management, make better food choices, and add herbs to help me reset. I have renewed energy and a commitment to my self-care. I lost 12 pounds in the process. Wish I found them so much sooner. Thank you, JC, for those kind words, and we wish you much health success. This week's organic food for thought is on prediabetes. Prediabetes is a condition defined as having blood glucose levels above normal, but below the defined threshold of diabetes. It's considered to be an at-risk state, with chances of developing diabetes. Without intervention, people with prediabetes are likely to become type 2 diabetics within 10 years. For people with prediabetes, the long-term damage to heart and circulatory system that is associated with diabetes may have started already. Prediabetes is not a new condition. It's a new name for a disorder that doctors have known about for a long time. A prediabetes diagnosis is a clear way of explaining that a person has higher than normal blood glucose levels and is in danger of developing diabetes, plus at a higher risk of chronic kidney disease and heart disease. When people understand that they're pre-diabetic, they're more likely to make lifestyle changes that can reduce their risk of developing type 2 diabetes, which is why noticing pre-diabetes symptoms is vital. People with pre-diabetes don't process glucose properly, which causes sugar to build up in the bloodstream instead of fueling the cells that make up the muscles and other tissues. Most of the glucose in your body comes from the foods you eat, especially sugary foods and simple carbohydrates. During digestion, the sugar from these foods enters your bloodstream. Then, with the help of insulin, sugar enters the body's cells where it's utilized as a source of energy. The hormone insulin is responsible for lowering the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. For people with prediabetes, this process does not work properly. Sugar is not used to fuel your cells. Instead, it builds up in your bloodstream because the pancreas doesn't make enough insulin, or your cells become resistant to the action of insulin.
Yeah, I think this is a really good food for thought, because we live in a time where we're over sugared. We consume too much sugar. A lot of times when our clients come in and we ask them, do you consume a lot of sugar or crave a lot of sugar? A lot of times they'll say no. But then once we talk a little bit more, come to find out they eat a lot of bread, they eat a lot of rice. In some cases, they eat a lot of fruit. And it's really about what turns into sugar. Obviously, white sugar is the pure sugar. Right. And you're just taking it right in. But foods turn into sugar as well. So we eat a lot of sugar in our diet, whether it's coming from juice, whether it's coming from natural sources like fruit, breads, rice, and other complex carbohydrates. We're over sugared. So we're constantly raising our blood sugar levels, and our body has to constantly produce this insulin to bring it down. And your body can become resistant to the insulin if it's always producing insulin. So on your journey of bettering your health and taking your health to the next level, one of the best things that you can do is to significantly reduce the amount of things that you consume that actually turn into sugar, especially in today's lifestyle. Like, most people are not active anymore. Most people are sitting down most of the time. So we don't need all of that sugar to burn for energy. Because we're sitting most of the time and we're not as active, you don't need as much sugar. So if you're more active, like, for example, if you're an athlete, you know, especially a professional athlete, obviously you're going to need to consume more things that convert into sugar.
Quick burning energy.
Exactly. Yeah. But if you're not very active, you need to minimize the amount of sugar that you have in your diet. So I think that that's a really good area to start. Begin to reduce the amount of added sugar. I would try to reduce that as much as possible. But then the things that turn into sugar, we're talking about carbs and complex carbs. You really want to begin to reduce those as well. I think we get in trouble with the so-called food pyramid, where they're telling you to have, I think it's like 6 to 8 servings of like carbohydrates daily, right? That's a lot. That's a lot of carbohydrates, and I would definitely bring that down to more like 2.
and even fruit. Yeah, because I think that's the misconception. Yeah, people think fruit is healthy, but it also depends on where you're at with your health.
Exactly.
So too much fruit, that's too much sugar as well. Even if it's more of it's not white processed sugar. If you are, pre-diabetic, or if you have high blood sugar levels, you have to be mindful of the fruit and maybe lean more towards berries, or kind of eliminating fruit for a while.
Yeah. I mean, you raise a good point with the fruit, because we have a lot of people that will stop with the processed sugars, but then they'll do all of the natural sugars. So they trade one sweet tooth for another. Right. So now it's just like, I'm going to have a bunch of bananas and apples and all of these things instead of having the processed fruit. It is better, but overall, it's not necessarily better for you, because I think the biggest problem with that is technology. Because, like, if we didn't have the technology to get fruit all year round, at some point it would stop. So you gorge yourself all summer with fruit. If you did that, then come the fall, there's no more fruit available, and your body can reset. It can take a break.
To another food group.
Exactly. But we don't have that. So now we can just eat these, varieties all year long,
because it comes frozen. It's readily available,
and our bodies don't get a break from it. So we oversugar ourselves. So that's a huge place to start, beginning to cut back on your sugar intake.
Right. Yeah. Definitely. So now let's segue into this week's episode. And as I mentioned, this is part 2 of our interview with Lisa Hendrickson-Jack, discussing the 5th vital sign. And so without further ado, let's dive into it.
So when we look at the body from a holistic perspective, it can speak to you in so many different ways, and it can really tell you a story. So my question is, when you're tracking the overall cycle, and certain indicators let you know a woman's health, what are some of the things that it can reveal, and also, does it reveal any major health challenges that we all experience? Does it give any indicators so that you may start looking at something early and can make adjustments and changes before it turns into major problems?
Yes, that's a really good question. I would say that one of the challenges is kind of like, one of the analogies I use in the book is one of my colleagues, Dr. Marguerite Duane. So she's an actual MD. And so she would say, like, just like any doctor who's trained, can read an electrocardiogram. So that's a report and assessment of your heart, the electrical activity of your heart, if you have concerns about potential heart attack. Any trained fertility awareness professional should be able to look at your chart and identify if there could be issues. So the first thing is to say that you would, a woman who doesn't have a background wouldn't necessarily know what it could mean, but she could certainly identify that there's something wrong.
Right. Mm-hmm. Yeah.
I'll give you a couple of examples, though, in things that my clients have discovered through charting. Mm-hmm. So one of the things that I talk about as much as I can on the podcast and with my clients is that cervical dysplasia, abnormal cervical cells, is something that's really common. And I didn't really realize how common it was until I started working with women one-on-one. Cervical dysplasia, basically the growth of abnormal cells on your cervix, is associated with long-term birth control use, which is interesting. Long-term birth control use depletes your folate levels, among a lot of other nutrients that are depleted. And there's the health of your cervix is inextricably linked with our folate production. So there's this really clear link in the literature with the pill, long-term use, depletion of folate, and an increased susceptibility to develop a persistent HPV infection, which is, the HPV is like the flu. So if you've ever had sex with another human, you've probably been exposed to it. But as women, we have immune systems. Everyone has immune systems. So we're typically able to fight it off, but the pill makes us less likely to fight it off. So that's like the background. So how this can show up in the menstrual cycle, when women are charting, so I teach charting in a specific way where you wipe yourself before and after you go to the bathroom, and you look at the toilet paper, you kind of see how it feels, and you're checking to see what, if you see mucus and what color is it and all that kind of stuff. So we're looking at it a bit more in depth. Mm-hmm. And so one of the things that you would never know unless someone told you to look for it is that women with cervical dysplasia, when they're wiping themselves, so like if you were to go to the bathroom and wipe yourself like before you actually go pee, women with dysplasia will often have a wetness that's consistently there. And depending on how far it has progressed, I've worked with women who describe it as though at certain times of their cycle, and so this is not when they're ovulating, it can happen whenever, which is one of the signs to look for. But women who will report like, oh, I feel this gushing. It's like there's water gushing out of me. But there's just this consistent like wetness because the cervix is releasing this discharge. It's not cervical mucus. It's not related to ovulation. It happens throughout the cycle. So I've supported a number of women through this very subtle observation to identify the development of abnormal cells very early. Because often that wetness, that consistent wetness, is there before the test even turns positive.
Right. Yeah.
So that's one example where you could literally identify abnormal cervical cells through charting. Yeah. Like if someone teaches you how to do that. A few other examples that come to mind of things that you could pick up. There was one example that I used in the book. It's not funny, so I shouldn't be laughing, but it's one of those like shake your heads. It's like, what is going on? So there was a woman who had some degree of bleeding every single day, every day. Wow. And she went to her doctor and they were like, well, it's normal or whatever. Wow. And she kept pushing and eventually got an ultrasound maybe 6 months later. Wow. And it turned out that she had uterine cancer.
Wow.
Like that is an example, but this is why we have to, again, look at the menstrual cycle as a vital sign, understand what normal looks like, and appreciate that, no, bleeding every day is absolutely not normal.
Right.
Bleeding, like, if you have a cycle occasionally where you have, like, a little spotting around ovulation, that is not uncommon. But, like, we have to have this appreciation for the cycle to recognize, no, this is important stuff.
Right.
So, I could go on. I've got all kinds of examples, but I'll leave it there. If you want me to give you more, I can certainly pull up a couple more.
Yeah, no, that was great. And that answered the question perfectly. One of the other things that you touched on was just nutrition factors and how that can influence in a positive way and in a negative way. And again, there's a lot of controversy out there as far as, what to eat. What are the best diets to help with your cycle? Can you talk about that a bit? Like, how can your diet influence your cycle in a positive and a negative way?
Yeah, it's a big topic. Mm-hmm. So for me, because I'm focusing on fertility and my work, I'm typically working with women of reproductive age, some of whom are not trying to conceive and they just want, they want to feel good. They want healthy cycles. They want optimal hormone production. And other women are specifically trying to get pregnant. So they're trying to often get their cycles back after they've been on birth control for a while. And just trying to get the hormones to develop. So there's a lot of different diets out there. This is a really interesting time in human history. I feel like when I was growing up in the 80s and 90s, the television told us what to eat and we didn't really question it. We just did it. So the television told us to eat margarine. We would eat margarine. You know what I mean? And this was before the internet, before anyone with a voice could go and tell you what to eat. So now we've got all these different types of diets and styles of eating, and it can be really confusing. When it comes to diets in general, I think I would hesitate at the thought that there's one diet for everybody at every point in your life. So if anything to take from this, because I can't tell people, how to eat, but it would be that there's different stages of our life that require different things. And women are not small men. So the certain diets that might help. So for example, if a person is dealing with an illness, if a person is dealing with cancer, the type of diet that person might need to eat to deal with cancer is not the same type of diet that one would necessarily eat when they're trying to have babies. So part of it would be trying to understand what unique and specific needs that your body might have at that particular point. So your child, when they're, growing rapidly, doubling in size, will have different needs, right? Then we would, you know what I mean? So I think part of it is just to try to recognize, there's no one, just this is for everybody should eat this way. That's not a real thing. And also if you're detoxifying, if you're focusing on getting rid of heavy metals and, a lot of us are trying to eat really clean and dealing with the realization of how horrible factory farms are and all the stuff in our food. So again, if you're detoxifying, if you're doing a specific thing for a specific reason, again, that might not be the optimal way to eat when you're trying to boost your hormone levels. So at the most basic level, we have to understand how our hormones are made. So our main ovarian hormones, estrogen and progesterone and testosterone, our other steroid hormones like cortisol and even vitamin D. So those are steroid hormones. We make steroid hormones from cholesterol. So you can pull up a textbook, Google it. There's a chart and you can see how cholesterol is at the top and then our body transforms that into pregnenolone and all of these different hormones are made directly from it. And cholesterol, we don't get cholesterol from avocados and coconut oil. Cholesterol only comes from animal foods. So that's a hard kind of realization that is literally in order. And our bodies can make some cholesterol, but that puts an additional strain on our liver if we're not necessarily consuming any. So I think that's kind of the first step. If you're wanting to support hormonal production, you're wanting to support ovarian function, and you're wanting to make sure that you've got adequate estrogen and progesterone throughout your cycle, the first thing just to know is how the hormones are made and where they're made from. And then just in terms of having an appreciation, understanding of, we can even talk about what things could interfere with the cycle. So I mentioned, inflammation. If we can get as close. So for me, I come from kind of an ancestral perspective. I'm always asking these annoying questions when my grandma was doing, or my great grandma in the West Indies, there was no Whole Foods. How did all of these people, how did they manage to have healthy kids and all this kind of stuff back then? So when you look at ancestral practices, the types of foods that they specifically ate when they were trying to conceive, and you look at the nutrients in those foods and compare them to what our body needs, it really sheds a lot of light about what we need to consume in order to have healthy fertility. So from the most basic level, we want to kind of go back to foods that are natural, foods that you can put on a plate and we all know what they are, like vegetables, animal foods, and but again, looking at where they come from, looking at how they're produced. If you have a feedlot cow that's eating genetically modified grain. Cows are supposed to eat grass.
Right.
We have that. When you look at so again, you can look at the research and it shows that when the cows eat the grains, grains themselves create meat that's more inflammatory, so it causes inflammation in those animals. So the actual meat, when they test it, has a completely thrown off ratio. We want to try to eat as close to like a 1-to-1 balance of omega-3 and omega-6 fatty acids as we can.
Yes.
The cows that eat all the grains have a highly inflammatory profile, much higher in omega-6. I remember Dr. Oz was kind of the first one to talk about that. And then the milk that those cows produce, highly inflammatory. So it's just something to think about. Like, it's not necessarily financially feasible for everybody to kind of go and eat everything organic and find a farmer.
Right.
You know what I mean? But it's something to be cognizant of, just to think about where our food is coming from. Is it, sprayed with pesticides? How is this working out? And there are specific foods that we can focus on that contain high, nutrition for fertility. Often it's not what people want to hear. I talk about liver a lot because liver is high in basically all of the nutrients that we need to support healthy fertility, for normal sperm and egg development. So for example, liver is high in vitamin B12, like all the B vitamins, vitamin B12, vitamin B6. Is high in iron, vitamin A, which is essential for hormone development and normal egg and sperm development. Choline and folate. We know how important folate is for fetal development. Choline works synergistically with folate to ensure normal neural tube development. And really, we could go on and on. Fish is a great source of omega-3 fatty acids to kind of like balance out some of the inflammation that, we're trying to have, and it's associated with an improvement in hormonal health. And I mean, I could go on, but I feel like just having a sense of what we need to build hormones and to support healthy cycles, and for those who are trying to conceive, what does the research say about what babies, like what we need to build a healthy baby? And it's often different to what we're seeing on the internet.
Right. Yeah, completely different. Thanks for saying that. I mean, you pretty much said it perfectly that, at different stages of your life and what it is that you're trying to do, the diet should look differently. And right now, diets that really detoxify the body is what's popular, and people will pretty much do that for everything. Like under every occasion, that's their go-to thing. But what you're saying is that if you're trying to work on fertility, that your diet is going to look completely different. And I was actually going to ask you for your top 3. What would be your top 3 fertility foods? You said liver. You mentioned fish. What would be your third one?
Let me think. My top 3 fertility foods. Yeah, liver is definitely at the top. Fish would definitely be number 2. And I suppose the third, I'm trying to think. It's hard to narrow it down. But I guess I would just say, I suppose like real unprocessed foods. I could put eggs. Eggs is a good, if you can tolerate eggs.
Yeah.
And I would sneak in like for a person who can tolerate dairy. So if you can tolerate dairy, then I would say full fat dairy. So there's a lot of, we went through the 80s and 90s of the anti-fat, we're being told that fat is bad and drinking skim milk and all that kind of stuff. So if you're consuming dairy, consume the full fat. There's research that shows that women who have issues with ovulation, there was a study where they had like 18,000 women, and they looked at the effect of diet on ovulation. And it was the women who consumed low-fat dairy that were at a higher risk of ovulatory infertility. So there was a correlation between consuming the fat. So I suppose it'd be those.
Yeah, that's great. You're right about the 80s just getting slammed so hard with the anti-fat movement. It seems like we still haven't recovered from that. And it's just very recently that fats are making a comeback in a sense. More people are starting to talk about the importance of them, even though mainstream wise it's still looked at as a bad thing. How important are fats when it comes to fertility? And when we talk about fats, what fats are best?
Well, I mean, as I mentioned, all of our steroid hormones are basically directly derived from cholesterol.
Yeah.
So one of the things that I'll say is, because I'm always focused on the menstrual cycle.
Mm-hmm.
And so in every client interaction that I have, the chart is front and center. Your menstrual cycle will give you the answer. So obviously, Jamal, you don't have a menstrual cycle. It's a little different. But for women, one of the great things is that if your diet is truly sustaining you and it's truly meeting all of your requirements, you would expect your cycle to fall within those normal range and parameters. And so for me, I often don't have to say a whole lot, because we look at the cycle, you know? Mm-hmm. So in terms of fat, so if you're looking to support your hormone health, again, I would encourage you to source the highest quality of whatever food that you're eating. Mm-hmm. But know that even if you can't do everything perfectly, there is still value in, eating conventional products. Mm-hmm. So when it comes to fats in particular, animal fats are not bad. Right. The key would be just looking, if possible, if you're able to source like local, it doesn't have to be organic, but farmers who let their animals eat grass is helpful. Yeah. Similarly with eggs. Like if you're able to get free range eggs, typically they're not that much different in price to the regular eggs at the store. Mm-hmm. Well, where I live, so I can't speak everywhere. So looking at those types, so like animal fats, and it kind of depends. Like if you can tolerate dairy, butter, if you happen to live in a place where you can get animal fat for cooking, like if you're able to get pastured lard or tallow or something like that, that's great. It can be really terrifying after all the years of being told that it's gonna, but it's just something to consider. In addition to trying to, incorporate animal fats, looking at fish and fish products, like eating fish, for women who are actively trying to conceive, like considering fish oil. A lot of women already do that. They take fish oil. Yeah. Cod liver oil. I mean, that's like a throwback for a lot of us. Yeah,
serious throwback.
What's interesting about cod liver and why the elders used to give it to us, it's a source of vitamin A. So one of the things that we need when we're trying to, just establish healthy hormones, establish vitamin A as an immune vitamin. It's associated with healthy immune systems. Yeah. It's crucial for fertility, for pregnancy, and I will say it again, for male sperm development. So there's a reason the elders were giving us cod liver oil. So, but just thinking of ways to incorporate omega-3 fats. And it's important to note that there's a difference between the omega-3 fats that we get from fish, like animals, versus the omega-3 that we get in flax seeds and chia seeds. So there's a lot of research to show that in order for us to assimilate that omega-3 fatty acid and put it in our brain and our baby's brain, and for it to have the anti-inflammatory effects, our body, when we're getting it from the animal foods, it is already in the form that we can easily assimilate. When we're getting it from flax seeds, it's in the form that we would have to actually convert. Mm-hmm. And the vast majority of us have a very limited ability to convert. So you wouldn't be getting the same level of omega-3s from the plant-based alternatives unless you're taking a supplement like a microalgae oil supplement. So it's just important to note as well that it's different when it comes from this, particularly the omega-3s, because the way that flax seeds and chia seeds are marketed would make you think that it's the same as what you get from fish. But it is not.
Right. Yeah. So, I mean, I think this is great education, and we definitely try to spread the word as well, and make it more common and help people to be more comfortable with, having this level of conversation, because, in the climate that we're in now, anything animal is the devil in a sense, if you consume it, it's going to hurt you. So people are almost afraid now to have it, and mentally they think that they're causing themselves harm. So we definitely want to try to educate people and make them feel more comfortable and let them know that if you're eating high source foods, you're eating the right foods in the right ways, that is going to bring health to your body. But there are a lot of people out there that, right now where they're at in their growth, they are adamant against it. Right. So in those cases, what suggestions would you make for them? Would they just be on, just high kind of vegetable fats, things like avocados and nuts and oils? Obviously, we would want them to consider at least supplementing with, like you said, fish oil and things like that. But for those who are adamant that they want to do this animal free, what are some things that, we could suggest to help them along the way?
Well, I mean, again, it depends on where that person is in their life.
Yeah.
So if somebody is past the reproductive age and they're just looking to be healthy, it's a different conversation.
Right.
Than
Absolutely.
If I'm talking to a woman that's actively trying to get pregnant right now.
Yeah. We're talking. Yes.
Yeah. So that's the first thing to say, because it's so controversial even to talk about vegetarian and vegan diets. Yeah. I find that every time I kind of try to steer away from the controversy, but every now and then I dive right into it.
Right.
So the first question would be where is this person at in their own personal journey right now? And why are they concerned about the diet? So if we're talking about a woman who's concerned about her menstrual cycle, if she's just wanting to optimize her cycles for health, but she's not trying to conceive or she doesn't plan to have children, then it might be a different conversation for her versus someone who's actually struggling to get pregnant.
Right.
One of the things I think that is helpful to do is to, read as much about it as possible. And if you are how do I say this? If you go online, you can find as much advice to support your argument as to oppose it.
Right.
So it's helpful to look for evidence-based sources who are looking at the research and not just supporting your own perspective. I think that's, first of all, because a lot of the information that's coming out about what to eat and how to live comes from older men who are not in women who are not in you see what I'm saying? It's a different diet when you're 60 and you're a man versus when you're 25 and trying to have a baby.
Right.
So you have to really question the resource, because in there's something to be said for you're not even trying to have kids. So this diet is not necessarily optimal for women who are actively doing that. So for a woman who's in that stage, she wants to optimize her cycle, she's actively trying to conceive, and maybe she's having trouble, maybe she's not, or maybe her menstrual cycles aren't the way that they're supposed to be. That's the first thing. The first thing from my very unique perspective is to look at the cycle. Look at the parameters we talked about. Is your period one day? Are you ovulating? Is your ovulation really delayed? Is your luteal phase the second half? If you're tracking your ovulation, are you getting your period about 12 days after at least? Or is it coming early? Are you spotting? So really, are you producing cervical mucus? So really looking at the cycle, first of all, because if you're not, so some of the diets, so for instance, some of the diets don't necessarily support optimal hormone production because you're not giving your body any animal fat, and you need animal fat to produce hormones. So some of these diets would be associated then with kind of a lower hormone profile. So if you see signs of that, you just have to be aware that it could be related. I think that's the first thing, because I can't tell anybody what to eat. You have to just be aware that the diet can affect your hormones and your cycle, and just know that. The second thing, if you're trying to conceive, it would be a good idea to have a consultation with your doctor, have a consultation with a functional doctor, someone who is looking at the root cause, and have a full assessment. So look at all of your nutrient levels, look at your zinc levels. When you consume a diet that does not contain any animal foods, you're at a greater risk of becoming deficient in certain nutrients, including vitamin A, zinc, vitamin B12. And a lot of people know this. So if you're an experienced vegetarian, if you're, aware of all of this, then you might already know. But it's a good idea to just have your levels tested. Test your vitamin D, test your vitamin B12, test your vitamin A. Make sure and know where the diet is know where there's holes in the diet, because especially for women who are trying to conceive, as more research comes out, as more nutritionists and doctors and naturopaths, as more of us come to this table and start this conversation, it's important just to question the guidelines, to question what you're being told. There's research that shows that even if you supplement perfect to the guidelines, that you may still end up deficient, because supplementation doesn't necessarily replace food. It helps, and it can help fill the gaps, but supplementation alone, you can't rely on supplementation alone to get optimal levels of all nutrients. Yeah. Because at the end of the day, we don't know everything. We don't know all of the nutritive cofactors in food. Right. We're still learning as human beings. So I think, pay attention to the cycle. Make sure to get yourself tested so that you know where you are deficient. Do your best to supplement, but if the supplement falls short, if the cycles aren't moving, if you're not getting the results that you want, if you're experiencing other health issues that seem unrelated and you're not sure what's going on, like underlying infections or gut problems or, all kinds of other stuff is going on, then at some point it's important just to ask, could it be related to what I'm eating?
Right. Yeah. Right. I think that's a perfect answer. Just women paying attention and charting and just really seeing, what that's saying. And that's going to tell them a lot on if what they're doing is working or if it isn't working, especially when they, go to the doctors, they get their levels tested and things like that. The proof is in the pudding, in a sense. One of the things that we're talking about is the charting. And for those who didn't listen to our first couple podcasts with you, can you just briefly kind of explain the fertility awareness method for women?
Yes. So basically, the fertility awareness method is a way to track and understand your menstrual cycle. In the menstrual cycle, from a scientific perspective, there are only 6 days when you are actually fertile. And so the reason for that is because you produce cervical mucus, which we've talked about a number of times, but we care about cervical mucus because it can keep sperm alive for up to 5 days. So essentially, when you look at the research, cervical mucus has been shown to keep sperm alive for anywhere from 3 to 5 days. And so basically, you're fertile for that window of the up to 5 days that your mucus could keep the sperm alive for, plus the day of ovulation, because ovulation only happens on one day of the cycle. So essentially, one of the examples I've been sharing is like you could have sex with your partner on Monday, unprotected sex, when you saw mucus. So you saw mucus on Monday and you have sex. It's wonderful. And then your partner goes off to like Japan or something on business. And then you don't ovulate till Friday, but you actually get pregnant on Friday because the sperm from the sex you had on Monday is still hanging out in your cervix, having a party, high-fiving each other, and waiting until ovulation. This is a real thing. And there's lots of like science behind it. So first of all, that's just to give you the sense of like, why is mucus important? How do you tell when a woman is fertile in her cycle, etc.? So essentially, fertility awareness allows you to identify which days of your cycle are fertile and help you to figure out how to confirm that you've ovulated so that you can use that information however you want. So some women learn that information and they want to use it as a birth control method. So if we can understand and identify which days of the cycle are fertile, learn to chart in a specific method. So I teach the Justice method. There's lots of different fertility awareness-based methods that are developed and designed around these principles. You add a buffer period. This has been tested. I teach a version of the symptothermal method, which is essentially the mucus. You check your cervical position and you also take your temperature. And between those 3 signs, you can identify the fertile window and confirm when ovulation has happened. and it's up to 99.4% effective when used correctly. So there is, again, research behind it, because a lot of people hear this stuff and they think, oh, it's the rhythm method, this doesn't work. It's not the same as the rhythm method, because the rhythm method involved taking an average. So you chart your cycles for a few minutes, and then you take an average and you kind of say, okay, usually ovulate on this day or whatever. Fertility awareness is different because you're actually checking on a daily basis and you're identifying which days are fertile and which days are not. And then, so if you're using it for birth control, you're avoiding unprotected sex during your fertile window. And then on the flip side, a lot of women discover fertility awareness when they're trying to get pregnant, and they realize, like, wait a minute, I'm not fertile every day. I've been having sex every other day for like 3 months and this isn't working. Right. So often women discover it then when it's like, wait a minute, there's more to this than I thought. How do I time sex correctly? So it helps you to time sex correctly because you know exactly when the fertile window is as you approach ovulation. And then, as we've been talking about throughout the episode, some women just want to learn more about their bodies and they want to track their cycles to have an understanding of how it could be related to their health. And of course, there's a combination of those three that women can kind of track.
So I know we covered a lot, and I know you have a new book out. Is everything that we covered in your new book? Can you tell us a little bit about it and everything that women can learn, that really everyone can learn from it?
Well, thank you for that. And yes, all of the topics that we covered are covered in the book. It's a really extensive resource. When I wrote it, my intention was, obviously these are important topics and important conversations to have. About 5 years ago, I started the Fertility Friday podcast. And really, it started because I had been charting my cycles and teaching women to chart for a really long time by then. And when I got pregnant with my eldest son, I started to kind of realize, like, wow, there's so many women who are struggling to conceive. And even though I had known this information for so many years, the average woman still has no idea how her bodies work or how her cycles work. Mm-hmm. So even after doing the podcast, I felt like I needed like a physical thing. I felt like I needed to be able to put the information in one place so that women could have access to it. And I didn't want to add another opinion piece to the world. So I did my due diligence and I corroborated the information with the scientific evidence. So the book is heavily cited. So for anyone who's like an egghead, kind of like I am, and really doesn't want to believe what I say, because you shouldn't really, mm-hmm. You should find out for yourself. So I wanted to make that accessible. So, everything that we talked about today, I've been referring to different studies and things like that. It's cited in the book. Mm-hmm. And it takes you through the understanding of the menstrual cycle as a vital sign, how it's connected to health, the different phases of the cycle, your period, your mucus, what does a normal cycle look like, all of that. It also takes you into 3 of the most common issues that can interfere with the menstrual cycle, namely thyroid disorders, polycystic ovary syndrome. We spoke about hypothalamic amenorrhea. There's other, topics that are discussed in there. I have a chapter extensively on diet to, again, share the research about what has been shown to support hormonal health and fertility. And I talk about the birth control pill. I have 2 chapters where I dive into that research, which is a whole other can of worms. Yeah. Yes. So there's a lot in there. It's really eye-opening, especially for anyone who has never heard this before. And so for any woman who's listening, who's just like, what is going on? How could I be, in my 20s or 30s or 40s and I've never heard this before? You're not alone. And I felt the same way when I discovered it, except that I was 18. So I've had a lot of time to process it. And obviously I'm still pissed off. So mm-hmm. The book is a positive way to channel those feelings.
Right. Yeah. And how can everyone get your book?
So it's available on Amazon. It's available in ebook, paperback, and now audio book formats, which is fun. And if you can actually listen to the first chapter for free, so you can head over to thefifthvitalsignbook.com, all spelled out, and you can download the first chapter for free there. And you can actually get the audiobook for free if you've never used Audible. So fertilityfriday.com/audible. I know, Kim, you and I, because I'm also always listening to audiobooks. So I had to get that out.
And if you're listening to this podcast, probably it's good for you too.
A question: Did you did you read your own book or did you have someone else read it?
Oh, I read it. You missed the conversation.
Yeah.
It was an adventure. I was a podcaster. I was a bit overconfident. I was like, this is going to be so easy. It turns out I'm a terrible reader, but I have excellent editors. So the book sounds good. Sounds really good.
Yeah. Yeah. I could only imagine it had to be tough. Wow. Okay. Well, that's great. That's great. And for those who want to actually, work with you directly, what can you give us information for people to contact you?
Well, yes, thank you for that. So my main website is fertilityfriday.com. And so you can go there, you can find me, contact programs information. I have two main programs at this stage. I have a 10-week group program, which is the most popular program. So I work with a group of women, usually 10 or so, over a period of 3 months, and we just go into depth and charting, and you come out the other side perfectly ready and willing and able to use this method for birth control or optimize your chances of conceiving. I have a 4-month one-on-one program, and I also have a course. I created a course, so it's a lot of me talking. I think it's 24 videos, but it essentially takes you through all of the knowledge about fertility awareness, as well as a lot of what we talked about today, but in a lot more depth. Mm-hmm. So lots of options for anyone who's because what I always say is fertility awareness isn't necessarily for every woman. Every woman doesn't necessarily want to chart their cycles as their method of birth control. But every woman has the right to know how her cycle works. And for the women for whom this resonates, we're already out the door. We're just show me how to do this. I want to figure out how to chart my cycles. So if that's you, I've got a lot for you.
Yeah. Thank you so much.
Yeah. Thank you. That was great.
Yeah. Keep doing the great work that you're doing.
Thank you. And thank you so much for having me back. This was a lot of fun, and you asked me a lot of great questions. So this was a really great interview.
Thank you.
All right. Thank you. So that is our conclusion of our interview with Lisa Hendrickson-Jack discussing the 5th vital sign. Hopefully you enjoyed the episode, but most importantly, you received value from it. And for access to the show notes pages, just go to lifestrengthandhealth.com/111. That's lifestrengthandhealth.com/111. And on there, we're going to list Lisa's contact information, links to purchase her book, the Audible book, also to access, she mentioned the free chapter that she is offering. We'll put a link to that as well. And also, it's a great way to find out about our wellness center, Life Strength and Health, and learn about all that we do and how we help people to feel and look their best naturally. And before we go, at the time of this recording, we are in the summer season, and it's a great time to do a detox. And we offer a line of our detoxes called our Elemental Detox programs, which are seasonal detox programs geared towards focusing on various parts of the body depending on the time of year. So to learn more about our detox programs, just go to lifestrengthandhealth.com/detox. And depending on when you're listening to this, and we will have a detox for that season. And our detoxes are meant to be done on your own. They range from 7, 14, or 21 days, depending on the time of year. They contained a thorough manual, the products that are required, the protocols, and there is also an extensive walkthrough video where Jamal kind of goes through the whole program with you to answer any of your questions or concerns. And then you can always reach out to us if you have any questions. So to learn more about our detox programs, just go to lifestrengthandhealth.com/detox. So thank you for listening. Stay tuned for next week's episode. And until next time, live healthier.
Yes. Peace and blessings, everyone. Live healthy.